Hey, Dr. Ocho Karens.
Hi, how are you?
I'm okay. I'm here with a question about something I know nothing about.
Well, hit me.
Let's talk vaginal rejuvenation.
Oh, vaginal rejuvenation. Okay.
What is it?
Well, vaginal rejuvenation, I guess you can think of it as an umbrella term to describe procedures, both surgical and non-surgical, that can be used to enhance the appearance and function of the vagina. Um, I don't really like the term rejuvenation because I think it um, kind of infers that there's something wrong with the vagina, that it needs to be rejuvenated. There's nothing wrong with anyone's vagina. So I personally like to use the term vaginal vitality.
Mm-hmm. Yeah, I like that.
Yeah.
So you said form and function, because when I've heard about it before, faintly, what registers in my mind is just appearance, but it's not just appearance,
It's
correct?
not just appearance. It really, the point of vaginal vitality, vaginal rejuvenation, is to also improve the function of the vagina, the vaginal mucosa. So, for many women of all ages, vaginal dryness can be an issue. Vaginal discharge can be an issue. And so, by improving each layer of the vaginal mucosa with penetrative energy, that's what the non surgical approach does. There are many different types of energy, different types of heat that are used, from radio frequency to laser. The whole purpose is to improve how the tissue functions, to improve those who have dryness, to help with improvement in that regard, and to help decrease excessive vaginal discharge.
Okay. And so what is it? What happens when someone comes into the office?
Very good question. So, someone comes into the office. First, someone really should receive a consultation with a provider, someone that provides these types of services, whether they're surgical or non-surgical, to gather whether you are actually a candidate for the procedures, if you even really need the procedures. After having a complete consultation, you come into the office and you undergo a procedure that's usually just minutes long if it's a non-surgical procedure, generally pretty comfortable, and have the procedure done.
Doing a consult to see if they need to do it or not. So let's say they do need to do it. They come in, it's a few minutes, and then do most people experience any side effects afterwards? Is there any pain after?
Well, for the non-surgical approach, there is little to no downtime. Most patients have no side effects afterwards, but just improvement in symptomatology. So decrease of discharge, resolution of vaginal dryness. Even for women who have urinary incontinence, uh, the non-surgical approach oftentimes does help with that. So they themselves are drier. They're not having as many episodes of incontinence as they were having before. For those women who are receiving the therapy because of pain with sex, they oftentimes, even after the first few procedures, have improvement in sex because there's an improvement in elasticity of the vagina.
Wow.
So most women don't have any symptoms at all, just improvement of their symptoms.
And are they able to be sexually active right after, or is there a delay?
There's no downtime. There's no delay. And so, yeah, to have sexual sex afterwards within the same 24-hour period is fine.
Wow. Wow. So who falls in the category of someone who might need this?
Really, anyone that has any of these complaints. There really is not an age group that only meets criteria. And so, if you have vaginal laxity, if you have vaginal dryness, if you have pain with sex, if you have urinary incontinence, you meet criteria to discuss vaginal vitality, whether it's a surgical or non surgical approach. This is an additive therapy. We do have other options, other medical options, but some women don't meet criteria. Women who have had a history of breast cancer, they are not those who you would use estrogen for vaginal dryness or even for painful sex. And so this procedure is a non-hormonal approach to achieve the same result. And so really anyone with these symptoms, anyone with these complaints has an option to receive more knowledge about the procedure and also has an option to partake in the procedure.
Wow. So I didn't connect the dots on it being an alternative, especially for women who have had cancer and are avoiding the estrogen treatments. That's really good. So if someone is listening now and they say, yep, sounds like me, what's the next steps for them?
So next steps is to find a provider that provides the services. Again, whether you're talking about the surgical and non-surgical approach, and today we've focused mainly on non-surgical approach because of the minimal downtime, because of the few side effects. That's what we've focused on. And here in our practice, we do provide these services. And so first step, like I said before, is a consultation. We provide online consultations via telehealth. Free consultations to discuss the procedures. And so to just make an appointment for a consultation is the first step.
Wow. So for free, someone could have their own chat like what I'm having with you for 20 minutes to figure out if they want to proceed.
Yeah. You know, I really believe in offering women all options that they meet criteria for. I have said this many times with you. I think knowledge is power. And I want to empower all of my patients to understand all of their options so they can make the decision that's best for their lives.
Yeah, this has been just through the course of all these chats that we have, the best thing that I've taken away is that we don't have to accept our bodies are magnificent and they do magnificent things, but we also don't have to live with pain or discomfort. You know, it can be alleviated, or at least we don't have to live with all the pain.
Yeah, it can be addressed. And not all options. There's nothing that's cookie cutter. Not all options fit all patients. And so, yes, you have to have a discussion to see what fits you the best. And that's where you start. That's where you start making positive impacts on your life. And moving forward by having a discussion, an open discussion, a complete discussion. And so that's one thing we offer here.
Mm-hmm. And so in that vein, is there anything that I've missed? Is there anything you want to make sure that people know about this?
I think the main thing I really want to get across is there's nothing wrong with anyone's vagina. There's nothing wrong with us as women. We are all individuals. Our body types are different. We've all gone through different episodes in our life, childbirth, any traumas, injuries, or just the stress of life. So there's nothing wrong with the vagina. Vaginal vitality, vaginal rejuvenation really just should be to address your concerns and the symptoms that you have, but have confidence and understanding that you are perfectly made.
Perfect. If you have any questions, if this seems of interest to you, then reach out, give Evotion a call, or check on their website, and you can set up your own online consultation for free. So thanks so much, Dr. Ojo Cairns.
Thank you.